Aloha and welcome back to the Kupuna Connections television program. I'm Cullen Hayashida with Kapi'olani Community College, and we're glad that you're here to watch our program today. I'd like to introduce our guests, and then we'll begin our program on medications, the taking charge of your medications. So Joy, can you introduce yourself?
Yes, so Cullen, I'm really happy to be here today to be able to share those things, but I just wanted to give you a brief description of what I do. I'm a pharmacist, and by training and certification, I'm a board-certified geriatric pharmacist, also a certified diabetes educator.
And an assistant professor at the School of Medicine.
And I also teach at the University of Hawaii, the Department of Medicine, and try to make our students, our medical students, more aware of what medications do and how to help patients with them.
Thank you. Okay, and Tony.
I'm the co-host for the Kupuna Connections series, and I'm the education coordinator at the Kupuna Education Center at Kapi'olani Community College, and a social worker by profession.
Okay, so let's start out broadly with regards to older adults and medications, right? And question being, you know, as we get older, there's this tendency to take medications or take more medications. Is this something that we should be aware of? I mean, are there problems with regards to drug sensitivity, you know, in comparison to young people? What can you say about this relationship between older people and meds?
Well, Cullen, there's a bunch of questions here, and I'll break them down into those questions. And what I heard was, first of all, older people take more medications, and that's a fact. As we get older, the body tends to not function as well as before, sometimes causing disease and conditions that need to be treated with medications. And then secondly, what happens to those medications as we get older, we don't metabolize the drugs as well. So what we call this is pharmacokinetics, pharmacodynamics. That means that the drugs are now, how the drug works in the body is working differently because kidney function, liver function, and everything in general starts slowing down. So we have to look at the metabolism, the excretion of that drug too. The rate slows down. So as an older adult, most older adults can use smaller doses and have the same effect as treating a middle-aged person.
Now, we had one slide that you shared with us with regards to this relationship in terms of the health risk of drugs for older adults. And let's look at this particular slide, and maybe you can explain what we're looking at here.
Okay, so that's the health risks of drugs with older adults. The health risks is that many older adults take multiple medications, and that's the first bullet.
Right.
And how this comes to be is that older adults go to see more than one physician. When they see more than one physician orders medications for that patient, and then unaware that another physician is ordering another medication that may interact or counteract with that medication, causing adverse reactions and outcomes. And that's why the highest number of admissions to emergency rooms are somehow related to adverse drug events or adverse drug reactions. Secondly, older age, again, going back to the body systems, that we don't metabolize drugs as quickly as we did when we were younger. So if you were given a drug at a normal dose for a young adult, the recommended dose, we might have side effects that somehow reflect or show us that there's a overdose, so leading to more complications. And the third bullet is special drugs. Special drugs meaning certain drugs on some criteria might say that these drugs should not be used in older adults because of the risks that outweigh the benefits. At that point where we see more side effects than the benefit that we would like, and especially when there's safer alternatives. And those are those special category of drugs that we try never to use in our older adults.
So we have to be especially careful. And the older adults that we're talking about here have to be especially careful when we talk about medications and medication uses.
Absolutely. So when we say taking charge of our medications, that means that we have a responsibility taking those medications and being aware of them and knowing what we take.
I guess there's an awful lot to know about medications. So if I'm taking several medications, say, what are some of the basic things I should know about all the medications that I'm taking?
So I think we can start by putting together a list. That you should always have a list with you of what medications you're taking. So that's the name of the drug.
Okay.
You should know either by the brand or the generic name, because there's always two names to a drug. And then the dose you're taking and the frequency. And if you know what those drugs are for, you might put that on the side as well. So those are kind of the critical factors that you should be able to tell me, and you should present them at every healthcare provider that you visit.
Okay, so whether or not you go to see your doctor or the pharmacist, then you should show them what you're currently taking.
Absolutely.
Okay.
Now, one of the things that I guess we are always concerned about are side effects. You know, medications always come with oftentimes some kind of side effects. What can you share about some of these side effects? And one of which, perhaps relates to falls. I think we have a slide that shares some of these points with regards to the impact of certain kinds of medications on falls.
So when we talk about side effects, I think the most, the most detrimental kind of side effect, or the most serious adverse effect is from drugs, is a fall. And because falls lead to other injuries, puts it at significant risk for morbidity and mortality. So when we're looking at that special drugs that can increase the risk for falls, there are 4 that come to mind, 4 categories that we should be aware of. And that's number 1, psychoactive drugs, which means anything that changes mood, anything that used to treat mental conditions, anything that alters the state of mind. For
So
example,
things like anxiety, depression.
exactly, and sleep. So if you take a medication that tries to put you to sleep, most people aren't aware that some drugs act very rapidly. They take their sleep medication, and maybe they decide to get up and go to the bathroom, get a drink of water. By then, the medication can quickly turn out the lights, and a patient, suffers a huge fall. The other types of medications are antihistamine drugs, which we mostly buy over the counter when we have a runny nose, when we feel the onset of a cold coming on. These over-the-counter medications called antihistamines really cause a lot of sedation. There are a few that don't, but they still have some side effects. And these are what we call anticholinergic side effects, which really cause a lot of sedation.
And we take them so commonly, you kind of don't really think about it, I guess.
Yeah, that's right. And I think we should be more careful about what we put into our bodies and know the side effects. And so one way, if we go to the store and just buy them without consulting with a doctor or physician, we can also use the pharmacist and inquire with the pharmacist at that store where you bought them from. What are the side effects and what should I be aware of, so that you don't increase your risk of falls.
I see.
The other 2 bullets is that drugs for pain.
Right.
There's drugs that for pain actually don't act at the site of the pain initially, but they actually suppress the pain receptor receptor in the brain sometimes, and so when it works in the brain to suppress the pain signal, then we also impair the judgment of the brain, so we reduce the cognitive function of that person, and which causes sometimes falls as well, causes sedation, and especially those powerful opioid-like pain relievers. And the last category is the vasodilator drugs. Vasodilators usually used for blood pressure, reducing blood pressure, but sometimes those drugs also reduce the blood pressure very well, that we cannot compensate when we try to bring it up quickly, like when we go from a lying down to sitting up position, and we're not aware of that, and so we suffer a fall from that
Too
as
much
well.
brain, too much blood loss in the brains?
Well,
or
the
that
body
could-
cannot maintain that pressure, bring the pressure up enough so that you have blood flow to the brain, that when you stand up or go from a lying to a sitting position.
So you got depression, you got balance, you got dizziness.
Right.
All of these things can impact on your fall, I guess.
Exactly.
Right.
I see.
Well, sometimes when we take medications, we don't feel any different. Like we can't tell if they're working. So if I don't really feel any different, should I just quit taking the medication?
Oh, no, absolutely not. A lot of times we were not aware of our blood pressure, for example, and
Right.
so that's why we have a lot of patients that just stop their medication because they don't feel any different. And the same thing for diabetes. So blood pressure medicines and diabetes medicines, whether you have a feeling or not, should never be stopped without consulting with your physician.
Okay.
Those are conditions that are have very serious outcomes when you don't treat them correctly.
Yeah, I guess so. When you're taking a pain medication, you know if it's working or not working.
Exactly.
Or
Exactly.
blood pressure,
You can't
they-
tell.
you can't tell.
Right.
Right.
And so you could make a mistake and say, well, I don't need it anymore.
Exactly.
Yeah, so that's not good.
That's
That's
right.
not good.
So I guess
Okay.
there are a lot of medications like that, and what you said is you should check with your doctor, and maybe they can see if it's working and let you know.
Absolutely.
Okay.
I think this is one thing that we had previously mentioned, but you have patients that see multiple doctors, and each of whom is providing multiple medications, and they're not talking to each other,
Right.
which obviously poses a huge challenge. And so, what kind of responsibility is with the doctor, or is with yourself, or what can you do to take charge?
So as an individual, we need to be aware of first, we need to carry that list, that medication list with us all the time to every provider we see, and have them review the drugs before adding any new drugs. So make that list, show your list to each of the providers that you see. Third, have a list reviewed before adding any medication, and this is such a significant problem with seeing multiple physicians,
Right.
because we may be treating, you might be treating and seeing another provider because of a side effect of a drug that another provider had ordered. And one common example is when we take the antihistamines, it makes our eyes very dry. It sometimes causes other problems like urinary retention and constipation. So then sometimes we seek medical advice from maybe an eye doctor, not knowing that we started another medication. And so then he orders a workup of the eye and then prescribes more medication. And this is very commonly done, and this is what we call polypharmacy.
Now, we had a slide that sort of summarized much of what you had said, and perhaps we can look at this slide
Okay.
right now.
Right, so,
Yeah, so you have making a list.
right.
showing the list. Yeah.
I guess one of the things that you've included in your comments just now is that it's also important to put down the medications that your doctor didn't prescribe, like the ones that you picked up from the pharmacy.
So there are a lot of medications that, and we may not know them as medications. We may think that they're just supplements. There are vitamins, and some people take more of these nutraceuticals or herbal medicines that also have side effects. And we need to know what those are as well. They may interfere with the ability or enhance some of the medications that we're already on. So if we have some of these, we need to have a list of those as well. And the last bullet point on that slide was to use one pharmacy so they know what all the medications you're on, and then share that list with them as well. For even the drugs that haven't been prescribed, that they don't make a prescription for, sometimes they can make notes in your chart or your profile, and they also can include that as just the profile drug in there that may have an interaction with the prescription drugs that have been prescribed to you.
Well, I guess some older people might say, well, I'll just go downstairs. I'm at the doctor's office. I'll go downstairs to that pharmacy because it's convenient.
Right.
Or I'll go down to this other drugstore because they got a sale. Or perhaps
That's
what you're
right.
saying is that that's not necessarily a good idea then. Huh?
Well, that's not the best way to have the pharmacist look at all your medications and detect some drug interactions, because we have a lot of high technology software systems that can detect drug interactions, that flags things for the pharmacist even before they fill them.
Oh, I see.
But they're not effective if you don't have a complete list.
Right.
Yeah.
Right?
So you do actually recommend getting all of your prescription medications at one pharmacy?
As much as possible.
Because they can track it for you.
Right, but there's some times where we're mandated by our insurance providers to use the mail order pharmacy. So then we need to really make sure that we have a list of those medications and maybe provide them to a pharmacy that keeps a record of most of our medications.
Now, would the pharmacy also keep track of your over-the-counter information as
They
well?
may. And I've seen software systems that actually allow you to put those in so that I can track those without actually filling them like a prescription.
I see. So these pharmacies will all have this kind of software that you're talking about.
Absolutely. Every single pharmacy has a computerized system that has record keeping, and I think that we should utilize that as well as the pharmacists. So you're entitled to talk with a pharmacist when you go to a pharmacy, and again, it's one of those that you waive your rights to if you sign away. Do you have any questions for the pharmacist? Do you understand your medications? And most people don't spend that time to ask.
That list of medications, though, you encourage people to keep it in their wallets or in their purses all the time. Is it?
Absolutely, I do.
I just wanted to go back to that, what you said about the pharmacist, because I think often when we go and get our prescription filled, I remember the person at the counter saying, do you want to talk to anybody? Do you have any questions?
Exactly.
And we pretty much just say, oh, no.
Right.
But I think it's a good thing for elders and their caregivers to know that that is a time that you can ask questions. And there is a
Yes.
pharmacist there with that expertise that can help you with any questions you might have or any concerns you might have about
Yes.
taking that particular medication.
Exactly.
So there's it gets quite complicated for a lot of people. When you start taking so many medications at different times during the day,
Yes.
it's not all synchronized in that sense. If it would be great if everything's morning, noon, and night, right? But then
Exactly.
sometimes it's got to be taken in between.
Absolutely.
It
With
gets pretty-
meals,
with meals.
after meals. 2 hours before you take this other medication.
Right.
And that's where you know, a pharmacist can really help sit down with you and manage a routine that will work for you, and find that alternatives such as extended release medications that can be taken once a day instead of twice a day. We have patients that do require those who have a caregiver that only can visit in the morning or in the evening, and we do help patients with managing their schedules.
That's a great point.
How about generic versus brand? I mean, are they the same, or what can you tell us about that? I mean, I'm sure our viewers are very interested in that question.
Well, by being FDA approved as a generic manufacturer, you need to meet certain requirements that come close to the brand name drugs. And, and generics, if they're approved by the FDA, then they should be safe and just as effective as brand name drugs. However, if you notice some changes in your condition, perhaps, that you may feel something different and don't have the efficacy as if you were taking another brand, then you might, you know, bring that up to the physician, who might say, maybe we better stick with one brand, the branded medication, instead of switching from month to month from one generic to the next, because most pharmacies will not keep the same generic generic manufacturer from month to month to month.
You mean the same medications can be manufactured by multiple pharmacy companies or manufacturing companies?
Yes.
And so it might be slightly different.
After their patent life has expired of a brand name drug, then multiple manufacturers can make it. And one example is Bayer. We only knew aspirin to be manufactured by Bayer.
That's right.
So if my grandparents said, "Can you buy me Bayer?" then it would be synonymous with, "Can you buy me aspirin?" But 10 or 15 years later, "Can you buy me Bayer?" and I might bring home another brand of Walgreens or some other manufacturer that has made that generic drug.
So I guess for the most part, generics are fine, but you still should pay attention, because occasionally you might be one of those few people, say, who there's some ingredient in there that's a little different for you.
Right. And one more point to add is that with drugs with very narrow therapeutic windows, which means that we have control of blood levels of the medication. For example, seizures. We have seizure medications that work very well in a certain window of concentration. But if we decide to change that brand name drug to a generic, it might fall below that window, and then we suffer a seizure. And if we've never had breakthrough seizures for a long time, and all of a sudden we switch to a generic drug, and then we have some negative outcomes, it's time to go back to the brand name.
Okay. What about costs? If I'm having trouble paying for my prescriptions, is there any suggestions you have about that?
Any help?
There's a lot of, unfortunately, patients who fall in that category, and a lot of the new drugs are very, very expensive because there are no alternatives. And most of those manufacturers have patient assistance programs. And that's when we need to ask the help of the doctor's office. Can you please help by filling out a patient assistance form for me, or contacting that pharmaceutical manufacturer's program, and they can usually provide either vouchers or sometimes, in the case, free medication, but it gets sent to the doctor's office where they need to arrange to have it picked up.
So the doctors do that, it's not the pharmacies.
Most of the time it's the offices that do that, because they need to document the condition of the patient.
Does it take a long time to actually get approval from a pharmacy?
I don't know how long that takes, but I know the process for example, if we get rejected, if the insurance company rejects our claim for a prescription, it might take a while for it to be reviewed. And maybe in that time, we might have to use an alternative medication.
I see. Okay. Well, we're just about out of time right now, so this is how fast time goes by on Kupuna Connections. But we've got our viewers out there that have gotten a lot of information from you, Joy. Perhaps you can share one last tip if they were to walk away from this program and say, I remember something that Joy said. What would that be?
And I think that would be keeping a list of your medications with you at all times. If
point.
you happen to have an emergency situation, I would want to be able to ask you, where's your medication list? And I want you to be able to pull that out or tell me where to get it so that we can prevent further adverse events from multiple medications.
Well, good point. Very good. Okay, I think that's about all the time that we have. Thank you very much for all this important information that you shared with the community. So thanks again for staying with us and watching this program on Kupuna Connections TV series on taking charge of your medications with Joy Higa, the University of Hawaii School of Medicine. Thank you again, and see you again next week. Aloha.